Welcome to The Doctor is In, everybody. I'm Dr. Freddie Gomez. As always, we're here to provide you with the virtual care you need during these very uncertain times. While we are under MECQ, we want to remind everyone to be more careful and mindful to practice proper hygiene and observe social distancing. Tumataas pa rin ang mga cases natin kaya all the more na kailangan mag-ingat po tayo. Much like any virus, the coronavirus mutates. In this episode, we break down the possible effects of this mutation in catching the virus or getting infected again later on. Infectious disease specialist Dr. Arthur Dessi Roman is our guest for today. Dr. Roman, it's typical for viruses to mutate. But in the case of the coronavirus, how fast is this virus mutating? At anong ibig sabihin nito para sa mga taong posibleng ma-infect with the coronavirus?
Actually, Doc, mutation is really something that's bad about viruses. A lot of viruses, especially the RNA viruses, they really undergo mutation. For example, if you take the case of flu vaccines, no, not flu vaccine, but flu virus in general, di ba? It's really common for the flu virus to mutate, and that is why every year it's really recommended for us to receive the annual flu vaccination kasi nga nagbabago yung itsura ng flu virus. And similar to the flu virus, your COVID-19, also an RNA virus, there is really a tendency to develop the mutations. In fact, there is a recent report that would tell us that there's a new strain of your COVID-19 virus, SARS-CoV-2, that is a bit more ano ba, infectious compared to the earlier strain that has been circulating. Although this particular report is just observed among cultures in the laboratory and not really among patients. Doc?
Yes. So all of this is expected, that viruses do
Yes,
mutate, but a lot
unfortunately.
of people are concerned that COVID-19 is changing into a scarier virus. Does it mean that as the virus mutates, it becomes more infectious or even to that matter more deadly?
In some viruses, that's really a concern. But for example, the new strain of the SARS coronavirus 2 that's causing COVID-19 that has been reported, the name is D614G. They seem to be, this strain seems to be more contagious, but again, just in the laboratory and not really among real patients. But in general, it has not been found to be more deadly.
Now, an important question, Doctor. Alam naman natin na vaccines for COVID-19 are still under clinical trials. But with the changes happening to the virus, nag-mutate po ito, how will it affect the success of the vaccines?
Actually, most vaccines expert would tell us that although there is really a high risk of mutations among your viruses, because of the different mechanisms of action and these different targets of the vaccine, it's still possible for us to come up with an effective vaccine against COVID-19. Now, looking into the figures as to the status of the vaccines that are being developed for release for use into humans, there are at least 26 registered vaccine candidates, and some of it have undergone the different phases of clinical trial already. At least 6 have reached phase 3 trials na. So medyo papalapit na tayo hopefully into the release of COVID-19 vaccines into the market. Sabi nga nila, di ba, Doc, this particular virus, yung COVID-19, SARS coronavirus 2 is really unprecedented, not only because it has affected a lot of people, but in terms of research and the development of therapeutics and the development of vaccine, na fast track talaga siya. And really, we are hoping for a fast one in terms of vaccine development.
That's right. That's right. And to add to that historic measures, this is the only time that ngayon pa lang itong mundo na nakaka-produce ng vaccine na ganito kabilis. So the research definitely is all focused on trying to get a vaccine, an effective vaccine out for COVID-19. Now, I would like to answer some questions from our viewers on Facebook. We have a question from Hasmin. Ang tanong niya, if the virus mutates, effective pa rin po ba ang hand washing as health precaution, as a health precaution?
Definitely.
What do you think, doctor?
Definitely, hand washing and hand hygiene is still very important because, number one, the virus remains to be very susceptible to alcohol at 60 to 70%. And remember that when you perform your hand washing, it's really the mechanical action of the soap and the water that removes the virus from the surface. And so the recommendation remains, and it's still very effective, yung hand washing and hand hygiene in the prevention of COVID-19.
That's right. So do not forget to wash your hands as often as possible. We have another question from Zethi. I commute to work daily. Does the use of face shields help to prevent infection?
Thank you, Zeti, for the question. There has been a publication already looking at the benefit of face shield. And sabi dun sa meta-analysis na yon, in that particular study, if you don't use a face shield, your risk of getting COVID-19 is around 16%. But if you use your face shield, the risk of getting COVID-19 decreases to as low as 5.5%. So meron talagang benefit yung paggamit ng face shield. In fact, nagkakaroon na ng move ngayon na gamitin yung face shield as part of the recommended protection when we go out in the community on top of our surgical mask.
Okay, but marami rin confusion, ano? Some people prefer to go out with just a face shield. What do you recommend, Dr. Roman? Dapat bang whenever wearing a face shield, dapat pa rin may mask pa rin all the time? Or is a face shield alone enough protection for both yourself, the wearer, and for those around them?
Yes, Doc. Thank you. Doc, the evidence for the face shield, the evidence that we have right now is we still have to use the mask, okay? Because the primary mode of transmission of COVID-19 is still respiratory droplet. And then you just have to put your face shield or goggles on top of your mask in order for you to not come in contact with the respiratory droplets coming from another infected individual, infecting your eyes or your nose, for example.
Very good advice. Now we'll take a
No?
quick break, but when we return, we'll discuss antibodies and their role in preventing COVID-19 infection. Stay with us. This is the Doctors In on CNN Philippines. We're glad to have you on the Doctors In. I'm Dr. Freddie Gomez. There are a number of countries that are considering the potential use of these so-called immunity passports. These passports would allow more freedom for those who have been infected with COVID-19. But is immunity from COVID-19 truly possible? We're back with Dr. Arthur Dessi Roman. He's an infectious disease specialist. Now, Dr. Roman, we've talked about antibodies and immunity against COVID-19 before, lalo na yung mga nakarecover na sa sakit na ito. Do antibodies really provide immunity against COVID-19? And if so, for how long?
Doc, we've come a long way. Di ba? Marami na tayong natutunan in terms of COVID-19 since the pandemic began in January or February. However, there are still things that we need to know further about this virus and infection. As far as the antibodies that are produced against COVID-19, unfortunately, we still need more evidence. Kailangan pa natin ng mas maraming pag-aaral para malaman natin kung neutralizing ba talaga or epektibo pa talaga yung antibodies that are produced against COVID-19. Yung sinatawag natin na immunity passport that you were discussing earlier, actually, WHO is recommending against the use of a COVID-19 immunity passport because we still are not sure how long, kung gaano katagal magpe-persist inside our body yung antibodies, especially yung dun sa mga antibodies produced after an infection. And we also don't know if they are really effective in fighting off the infection. And this is the reason why even after a person, for example, recovers from COVID-19, nag-positive na siya sa antibodies kasi ginawan siya ng antibody test, it's still recommended that patient that particular recovered patient should still use yung mga infection prevention and control measures that we are advocating. So kailangan pa rin yung paggamit ng mask, kailangan pa rin yung physical distancing, face shield, and all the other strategies.
Okay, so just in order for our viewers to understand, Dr. Roman, these patients who have kung yung mga gumaling sa COVID-19, itong mga pasyente na to na katulad ng sinabi mo, nag-form na ng antibodies, kailangan pa rin nilang mag-protect sa sarili nila, but there is some level of antibody protection pa rin. What level of antibodies do we actually need in order to be protected from reinfection or possible reinfection for that matter?
I wish I had the answer, Doc Freddy, but unfortunately, as of now, we still don't know that level. We don't know that level compared to, halimbawa, the levels of antibodies needed for rabies protection or measles protection. We don't know that yet. What we know is, halimbawa, from human coronavirus infection, di ba merong human coronavirus in the past, after you get your active infection and then you recover, you are immune from those human coronaviruses for 2 to 3 years, and then you can basically get the infection again. For coronavirus infection, for COVID-19, we don't know that yet. Remember, Doc Freddy, that we just we just encountered the pandemic, nung January and February, and we are still trying to observe all of these patients who have recovered, kung gaano katagal magpe-persist sa kanila yung antibodies that they were able to produce after they were infected and recovered.
Okay, so just a warning for our viewers who have recovered from coronavirus. Do not let your guard down.
Correct.
There still needs to be studies, but the evidence have shown na there is some possibility, at least some possibility na pwede pa rin kayong ma-infect with COVID-19 even after you have recovered. So ngayon, sagutin naman natin ang mga tanong mula sa Facebook. We have a question from Hanilet. Ang tanong ni Hanilet, may epekto po ba ang mutation ng virus sa kaso ng reinfection? I think we talked a little bit about this, Dr. Roman.
That's right, Doc Freddy. I'd like to thank Hani Let for the question. Reinfection at this point is still very controversial, Doc Freddy. There are several cases and there are stories that you might have heard that will tell us na baka na-reinfect yung isang individual. Because halimbawa, nag-positive siya initially, tapos ni-repeat yung test, nag-negative, tapos nag-positive uli after some time. Now, we have to remember that hindi naman po foolproof yung ating testing, and you have to remember that the results of our test, you would always have to put in the context of a lot of things, di ba? You have to take a look at the quality of the specimen, the timing of the specimen, the context, yung clinical symptoms, and the exposure of the patient. While we are not discounting the fact, the possibility of a reinfection, at this point, wala pa rin po tayong masyadong evidence that indeed there's reinfection. Kaya nga, we are still advocating not to let our guards down, and whether or not we have been reinfected or we have not been infected by COVID-19, it's always best to practice infection prevention and control measures. Doc Freddy?
Yes. May tanong din si Charmaine. Ang tanong ni Charmaine, what kind of treatment or care is given to those who reacquired COVID-19?
Treatment. Okay? So, as of now, Doc, we still provide our patient with supportive treatment, supportive therapy. Pag sinabi po nating supportive therapy, number one, if there is a need for support ng oxygen, then we provide oxygen. Kung sobrang hirap yung pasyente, then we might have to put the patient on a mechanical ventilator just to provide the oxygen habang meron pang severe na pneumonia yung pasyente. If there's a need to give antibiotics kasi merong superimposed, may nakapatong na bacterial infection, then we give the antibiotics. If there is a need for us to give water, IV fluid, or hydration sa pasyente, then we give IV hydration. Now, there are investigational drugs right now that we are giving because there seems to be some benefit when we give them. For example, remdesivir, which is an antiviral, Of course, we need some more evidence as far as the use of these interventional drugs are concerned. Another thing that we are giving our patients, severe patients, COVID-19, would be an example of a steroid, dexamethasone yung tawag. But again, the use of this dexamethasone is really for severe oxygen requiring patients. Now, there are ongoing clinical trials looking into the other interventions. Hopefully, the results of these clinical trials will be available soon, and hopefully positive yung results, I mean, in terms of benefit for our patients. But until we have the final results of those clinical trials are concerned, supportive treatment po tayo ngayon, Doc Freddy.
Dr. Arthur Dessi Roman, marami pong salamat. We're glad you were able to join us here today on the show and share with us once again your expertise. When we return, let's talk about how face masks can help us in this time of COVID 19. You're watching The Doctor Is In. We'll be right back.
As we move to the next stage of easing restrictions, the reality is the COVID-19 pandemic is far from over. The coronavirus remains a serious public health risk. Good personal hygiene is our first line of defense. Wash your hands often with soap and water and for at least 20 seconds. Scrub all surfaces of the hands. If hand washing is not immediately available, use alcohol-based hand sanitizers. Wear a mask. The coronavirus is transmitted through direct contact with respiratory droplets of an infected person generated through sneezing or coughing. Cover your mouth and nose with a tissue or handkerchief when sneezing or coughing. Avoid touching your face. Maintain social distancing. Keep a safe distance of at least a meter from others whenever possible. Avoid crowds. Stay at home if you have any cold or flu-like symptoms and seek medical advice. We're in this together.
Welcome back to The Doctor Is In. There are many about getting infected with COVID 19, and for some others, those who might catch it again. Aside from social distancing and observing good personal hygiene, we are also advised to wear masks. Pero lahat ba ng masks na nabibili natin ay effective? Alamin natin yan. To join us today and share their expertise with regards to effective masks, we are joined by Dr. Vivien Fe Fadrilan-Camacho. She is a public health physician and associate professor at the College of Public Health, UP Manila. She's here to discuss the effectiveness of these masks. Dr. Camacho, we're months into this pandemic and until today, marami pa rin ang nalilito kung anong klase ng face mask ang dapat natin gamitin. For those who are not medical frontliners, what type of mask should they use?
Yes, isang magandang hapon po sa inyong lahat, ano. So, tama ka diyan, Doc. W matagal na 'tong COVID-19 na ito and yet napakarami pa rin ang, naguguluhan. Ano ba talaga ang, dapat na mask na gamitin, pare-pareho ba ito? Napakarami ho ang naglipanan nito online and sa mga stores, 'no. So, ano ba dito ang mga mask na dapat para sa atin? So actually there are different types of masks, no? And actually po dahil nagkakaroon ng mga sitwasyon wherein nagkukulang ang mask dahil nagpa-panic buying ang mga tao. So meron tayong tinatawag na yung ating medical o surgical masks, okay? So ideally sana sila ay para sa ating mga i-prioritize po natin yan para sa ating mga healthcare workers or ito yung mga nagagamit sa mga healthcare settings natin, sa ospital, sa clinics, ayan. For community settings naman, of course, syempre yung ating pang-araw-araw, no, sa bahay ba o sa community nga, pwede na gamitin ang cloth mask na tinatawag, okay? So, pero dapat itong mga mask nga na ito ay hindi lang porket may mask ka na ay 100% protected ka na. These masks should be worn properly. Okay? So, idagdag ko lang na dun sa medical mask natin or surgical mask, meron din tayong tinatawag na mga respirator. So, ito yung mga N95, no? So, ito yung medyo mas mahal at syempre mas mataas yung tinatawag na filtration efficiency o yung kanilang effectiveness. Pero ito nga ay sila ay pina-prioritize na ibigay sa ating mga healthcare workers.
Okay, now Dr. Camacho, there is a mask going around available with a front valve or a respirator that we are seeing more often. Does this help in preventing the spread of COVID-19 or mas nakasasama pa ito? Itong front valve na ito.
Oo. So, as you all know 'no, mahirap yung, buong araw ka naka-mask or the whole time you're wearing masks, 'di ba? So, ano siya, very uncomfortable. So, yung iba 'no, kaya lumabas din siguro 'tong mga tinatawag na mga masks na merong, valves or vents na tinatawag 'no. But unfortunately, the Centers for Disease Prevention and Control o yung CDC na tinatawag, and even other authorities no sa healthcare do not recommend the use po of these type of masks. Bakit? Syempre tayo we want to be comfortable sana while wearing masks. Kaya lang, syempre, tong valve na to, it serves an outlet for our expelled air. Pero syempre pag nag-exhale tayo tapos tayo ay may virus or may infection, syempre ine-expel din natin yung respiratory droplets na may virus, no? So, na pwedeng maging source of spread of infection. So, warning talaga to the public na iwasan din natin tong masks with valves.
Okay, since meron nabibiling itong masks with valves na to, no, just for our viewers' knowledge, para saan ba dapat ginagamit itong mga masks with valves?
Ah,
What is the
okay.
direct implication or saan ginawa itong mga masks na to para sa anong gawain?
Well, ideally kasi 'no, so dapat ito yung sa mga, low risk transmission area sana 'no, pero, dahil sa setting natin ay, medyo mataas ang ating mga kaso at tinatawag na, mataas ang ating infection rates, kaya we really prefer yung, actually yung tinatawag na, uh yung masks na recommended, no? So you have the surgical or the medical masks, and even the respirators, lalo na dun sa may mga high risk activities in healthcare facilities, at yung cloth masks in the community. Actually, itong mga masks with valves, actually baka ito ay nai-produce or na-manufacture to yun nga to facilitate comfort supposed to be, pero yun na nga na naging komportable ka pero nako-compromise naman yung actual purpose of the mask, which is to prevent the spread of infection.
That's right. These masks with the one-way valves hindi po siya recommended for the knowledge of our viewers. And these masks were originally made for those who did work siguro in forms of dust, siguro yung mga nagka-carpentry work. So like what you said, for comfort po ito. But in our setting right now, ngayon na may pandemic, ngayon na merong we want to prevent the virus, the COVID-19 virus being spread from one person to the next, we need to stay away from masks with open ports, open vents, or one-way valves. Okay, so now let's take a look at our social media questions. We have a lot of questions piling up here. So from our viewers, thank you very much for sending in those questions. Ang una nating tanong ay kay Lizelle. Ang tanong ni Lizelle, when is it recommended to use gloves? Very practical question. What do you think, Dr. Camacho?
Ayan, so ano yan ano, 'tong question na 'to, siyempre aside from mask, ano ba yung, siyempre lahat ng tao parang gusto na rin, mag-wear no ano yung mga possible protection. And gloves can be considered one of them, but based sa guidelines and recommendations actually ng mga ating mga experts in the community setting o yung lalo na in terms in the context of itong COVID-19 prevention and control, yung routine use of gloves ay hindi siya recommended, no? Actually, syempre, ito given na that these are being used in the healthcare facilities, lalo na if um, it, not only in healthcare facilities, pwede rin sa bahay or doon sa mga taong nag-aalaga ng mga may sakit, especially if with COVID-19. Pero yung routine, lalo na sa community, it's not recommended. Actually, ang sabi nga sa ating ang sabi nga sa guidelines at ang ating mga experts, pag itong paggamit ng gloves ay puwedeng itong instead na maka-prevent, puwede pa itong um, increase ng spread ng virus, no? Especially if they're not properly used and not properly disposed. Dahil yun na nga 'no, dahil merong sense of security na, "Uy, naka-gloves ako." So, kahit saan pwede na lang maghawak or mag-touch ng surface. So, which is actually not the case kasi puwedeng hindi siya nahahawaan pero nasa-spread niya yung virus 'no. So, yun naman yung disadvantage nga nung sa mask. But definitely for healthcare setting and for those who are taking care of the sick, tsaka yung medical use of gloves, given na yun.
Thank you very much, Dr. Vivien Fe Fadrilan-Camacho, for helping us answer those questions for today. And to our viewers, thank you for joining us again today. Remember, everyone, act like you have the virus. Let's all work together to help stop the spread of COVID-19. I'm Dr. Freddie Gomez. Stay safe, everyone.